Obtaining a biopsy. Patients may have a small growth, mole, or skin tag removed by the physician. Most times, the physician, after removing the growth, will send this specimen to the laboratory to be analyzed. This is called a biopsy. The specimen biopsied will need to be placed in a container of formalin to preserve it until it is analyzed in the laboratory. There may be instances when the physician will do a needle biopsy. This procedure involves using a needle and a syringe to aspirate either tissue or fluid to be sent for laboratory analysis. Whether assisting with a needle biopsy or one in which the tissue is removed by cutting it away, you should always maintain a sterile field to minimize the chance of infection. Other guidelines include explain the procedure to the patient, reassure the patient as needed throughout the procedure, accurately label the specimen for laboratory analysis, clean the area after the procedure, and properly dispose of any waste material. Electrocauterization. An electrocautery device is used for electrocauterization, which involves the use of a heated electric current. This technique can be used to control the bleeding of a nosebleed. It can also be used to burn away warts or other growth. These devices use either disposable tips or reusable tips. If the unit used by your office utilizes the reusable tips, it may be your responsibility to clean these in the autoclave. Autoclave is a sterilization process for instruments that uses steam under pressure. Every medical practice should have this machine to sterilize instruments. Cryosurgery. Cryosurgery is another technique used to remove warts, skin tags, or other growth. Cryosurgery involves the use of extreme cold to destroy or remove tissue. This procedure uses the application of liquid nitrogen to the area. The medical office assistant should instruct the patient that initially they would feel a cold sensation followed by a burning sensation. Inform the patient, Greek, dissolved, annulled, it is not unusual to experience swelling, discomfort, or possibly a blister or revoked, which should heal in 1 to 2 weeks. The patients should also be made aware that this procedure might need to be repeated, particularly when removing a wart. Wound debridement. Wound debridement involves removing debris or dead tissue from a wound or burn. Sterile technique is always used as the physician uses scissors and forceps to remove the skin or tissue. The wound should be cleansed with sterile saline or water to prevent infection and then redressed as per the physician's order. Incision and drainage. A common complaint often seen in a medical office is that of a patient with an abscess. An abscess is a collection of pus, which is usually surrounded by red swollen tissue. An abscess is frequently an indication of a localized infection. Abscesses can often drain on their own, but most likely will require an incision and drainage, I&D. To perform this procedure, the physician will make an incision or cut into the abscess using a sterile scalpel cutting instrument. The abscess will then drain on its own, or possibly the physician will insert a tube to promote drainage. The medical office assistant will be involved in explanation of the procedure, obtaining written consent, gathering needed equipment, preparation of the area by cleansing the area with the order antiseptic solution, assisting the physician as needed, dressing the area as order, and giving the patient instructions as to the care at home, properly disposing of waste materials.